Ibrutinib is a medication commonly prescribed for the treatment of certain blood cancers, including chronic lymphocytic leukemia, KIA, mantle cell lymphoma, MCL, and Waldenstrom macroglobulinemia, WM. While ibrutinib has demonstrated significant efficacy in managing these conditions, it is important to explore alternative medications that may offer similar benefits for individuals who cannot tolerate or prefer alternatives to ibrutinib. In this comprehensive guide, we will discuss alternative medications to ibrutinib, their mechanisms of action, potential benefits, and considerations for their use. Understanding blood cancer. Blood cancer, also known as hematologic cancer, is a type of cancer that affects the blood, bone marrow, and lymphatic system. There are three main types of blood cancer: leukemia, lymphoma, and myeloma. Leukemia is a cancer of the blood and bone marrow, which affects the production of blood cells. Lymphoma is a cancer of the lymphatic system, which is responsible for fighting infections. Myeloma is a cancer of the plasma cells, which produce antibodies to help fight infections. Blood cancer can be difficult to treat and can have devastating effects on the body. Symptoms of blood cancer include fatigue, weakness, fever, weight loss, and night sweats. Treatment for blood cancer depends on the type and stage of the cancer. It can include chemotherapy, radiation therapy, stem cell transplant, and targeted therapy. How ibrutinib works. Ibrutinib is a targeted therapy drug that has been shown to be highly effective in treating various types of blood cancer. It works by targeting and inhibiting a protein called Bruton's tyrosine kinase, BTK, which is essential for the survival and growth of cancer cells. BTK is a protein that plays a key role in the development and function of B cells, which are a type of white blood cell that produces antibodies to fight infections. In patients with blood cancer, BTK becomes overactive, which leads to the abnormal growth and proliferation of cancer cells. Ibrutinib works by binding to BTK, which prevents it from functioning and inhibits the growth and survival of cancer cells. This targeted approach minimizes damage to healthy cells and reduces the side effects associated with traditional chemotherapy. Clinical trials and studies of ibrutinib. Ibrutinib has undergone extensive clinical trials and studies to evaluate its effectiveness and safety in treating various types of blood cancer. In clinical trials, ibrutinib has been shown to be highly effective in treating chronic lymphocytic leukemia, KIA, mantle cell lymphoma, MCL, and Waldenstrom's macroglobulinemia, WM. One of the major clinical trials of ibrutinib was the RESONATE trial, which evaluated the effectiveness of ibrutinib in patients with KIA. The trial found that ibrutinib was significantly more effective than traditional chemotherapy in treating KIA and had fewer side effects. Another clinical trial, the RAY trial, evaluated the effectiveness of ibrutinib in patients with MCL. The trial found that ibrutinib was highly effective in treating MCL and had a good safety profile. Effectiveness of ibrutinib in treating blood cancer. Ibrutinib has shown to be highly effective in treating various types of blood cancer. In clinical trials, ibrutinib has been shown to improve response rates and prolong progression-free survival in patients with KIA, MCL, and WM. In KIA, ibrutinib has been shown to significantly improve overall survival and progression-free survival compared to traditional chemotherapy. In MCL, ibrutinib has been shown to improve response rates and prolong progression-free survival. In WM, ibrutinib has been shown to be highly effective in reducing the levels of monoclonal protein, which is a key marker of the disease. This reduction in monoclonal protein levels can lead to improved symptoms and a better quality of life for patients with WM. Side effects of ibrutinib. Ibrutinib has fewer side effects than traditional chemotherapy. The most common side effects of ibrutinib include diarrhea, fatigue, nausea, and bruising. These side effects are generally mild and can be managed with supportive care. More serious side effects of ibrutinib include bleeding, infections, and atrial fibrillation. Bleeding can occur due to the inhibition of platelet function by ibrutinib. Infections can occur due to the inhibition of BTK, which plays a role in the immune response. Atrial fibrillation can occur due to the inhibition of BTK, which plays a role in heart function. Dosage and administration of ibrutinib. Ibrutinib is administered orally in capsule form. The recommended dosage of ibrutinib varies depending on the type of blood cancer being treated. For KIA and WM, the recommended dosage is 420 mg once daily. For MCL, the recommended dosage is 560 mg once daily. Ibrutinib should be taken on an empty stomach, at least 1 hour before or 2 hours after a meal. Capsules should be swallowed whole with water and should not be opened, crushed, or chewed. Availability and cost of ibrutinib. Ibrutinib is available under the brand name Imbruvica. It is currently approved for the treatment of KA, MCL, and WM. Imbruvica is available in most countries, including the United States, Canada, Europe, and Australia. The cost of Imbruvica varies depending on the country and insurance coverage. In the United States, the cost of Imbruvica can range from $148,000 to $180,000 per year, depending on the dosage and duration of treatment. Alternatives to ibrutinib. There are several alternatives to ibrutinib for the treatment of blood cancer. These include traditional chemotherapy, radiation therapy, stem cell transplant, and other targeted therapy drugs. Traditional chemotherapy is a treatment that uses drugs to kill cancer cells. It can be effective in treating blood cancer, but it can also have significant side effects and damage to healthy cells. Radiation therapy is a treatment that uses high-energy radiation to kill cancer cells. It can be effective in treating blood cancer, but it can also have significant side effects and damage to healthy cells. Stem cell transplant is a treatment that involves replacing damaged or diseased bone marrow with healthy stem cells. It can be effective in treating blood cancer, but it can also have significant risks and complications. Other targeted therapy drugs that are available for the treatment of blood cancer include idelalisib and venetoclax. These drugs work by targeting specific proteins that are essential for the survival and growth of cancer cells. Alternative medications to consider. Acalabrutinib. Acalabrutinib is a targeted therapy that, like ibrutinib, inhibits BTK. It is approved for the treatment of KA and MCL. Acalabrutinib has shown comparable efficacy to ibrutinib with a potentially more favorable side effect profile. Venetoclax. Venetoclax is a different type of targeted therapy known as a BCL2 inhibitor. It is approved for the treatment of KA and works by blocking a protein called BCL2, which helps cancer cells survive. Venetoclax is often used in combination with other medications and has demonstrated promising results in managing KA. Idelalisib. Idelalisib is a targeted therapy that inhibits a protein called PI3K delta, which is involved in the growth and survival of cancer cells. It is approved for the treatment of KA and is sometimes used in combination with other medications. Rituximab. Rituximab is an immunotherapy medication that targets a protein called CD20 on the surface of cancer cells. It is approved for the treatment of KA, MCL, and WM and is often used in combination with other medications. Bendamustine. Bendamustine is a chemotherapy medication that is commonly used in combination with other drugs for the treatment of KA and MCL. It works by damaging the DNA in cancer cells, leading to their destruction. Conclusion. Ibrutinib has been shown to be a highly effective and targeted therapy drug for the treatment of blood cancer. It works by inhibiting a protein that is essential for the survival and growth of cancer cells, thus preventing their proliferation. With its high success rate and minimal side effects, ibrutinib has become a game-changer in the fight against blood cancer and has given hope to millions of patients worldwide. However, it is important to note that there are alternative treatments available for blood cancer, and patients should work with their healthcare providers to determine the best treatment plan for their individual needs. Thanks for watching.